want to tell you about a letter that just landed in the hands of parents across Newfoundland and Labrador, and it's raising some very serious questions. According to a memo from Newfoundland Health Services, beginning this fall, the province will launch a youth awareness campaign for My Health NL, the government's online patient portal. Now, in that memo is a policy change that a lot of parents are only now learning about. Once a child turns 12 years old, parents no longer have automatic access to their child's health records. From ages 12 to 15, a parent can only access those records with the child's consent. Then at 16, the young person gets full control over who can access their health information. Let's be clear, kids have a right to privacy, sort of. There are situations where confidentiality is important, and there are exceptional circumstances where keeping information private protects a vulnerable young person. Okay. But that's not what we're talking about here. We're talking about making it the default position that mom and dad are shut out of their child's medical information beginning at age 12. 12! A child who still needs permission to go on a field trip, a child who can't vote, can't drive, can't get a tattoo, can't buy cough syrup in some cases, and can't even stay home alone overnight in many families. But somehow that child is now expected to decide whether their parents should know about their medical information. Parents are legally responsible for their children. They're expected to make sure their kids attend appointments, understand diagnoses, follow treatment plans, take medication, and receive proper care. How exactly are they supposed to do that if they're denied access to the information they need? What happens if a child doesn't understand the seriousness of a diagnosis? What happens if they're scared, embarrassed, or simply don't appreciate the consequences of withholding information from mom and dad? And let's be honest here. 12-year-olds are wonderful, but they're not exactly known for making flawless decisions. I know, I've had 3. This policy fundamentally changes the relationship between parents and the healthcare system. It shifts authority away from the people who are legally and morally responsible for a child's well-being. And perhaps more importantly, many parents don't even know this was happening until the letter showed up in their inbox. And a policy this significant deserves a real public conversation. Parents should be asking questions. What information will be withheld? Under what circumstances? Who on earth decided age 12 was the appropriate threshold? And what safeguards are in place to ensure children don't fall through the cracks because the adults responsible for them are left in the dark? Under this policy, parents, I think they have a pretty straightforward question. If my 12-year-old can keep parts of their medical record private from me, could that include consultations about gender identity or medical transition? The government hasn't directly answered that question, and the lack of clarity is exactly what's causing so much concern. A parent's responsibility doesn't end on a child's 12th birthday. And many Newfoundland and Labrador families are now wondering why their right to advocate for their own children seems to end there instead. For Rebel News, I'm Sheila Gunn Reid. Withholding this information from Newfoundland and Labrador parents could result in teachers and other educators influencing children about gender transition behind their parents' backs. That's chilling. To sign our petition against this sort of classroom grooming, go to stopclassroomgrooming.com.